Well, thank you. And as much as I'm an environment conservationist, I'm also an aspirant, member of Parliament Kibra 2022 this year, and hoping to be sitting in Parliament to actually discuss about these matters in length and in broad ways, making policies and actually looking into frameworks. But what I know, Kenya, we have a lot of legislations and policies. What we need is just to strengthen and actually make emphasis on the ones that are actually very important and the emergent issues. For instance, this one is emergent. That is why we're here to discuss, bearing in mind this financial year 2022 and 2023, the allocation for sanitary pads has been slashed from 403 million to actually 200 million. So it shows that a lot needs to be done. Voices of women is important in Parliament because this is the voice of reason that could actually put the issues forward in line with the need and dignity of the young girls and women in Kenya. So it is it's just a platform for us to actually get into Parliament. It shows that the women who are there, maybe they didn't know what was happening, or they underperformed, or they're ignorant for that matter, but just to give them a good excuse, it's maybe they are bypassed and they are few. So what we need is to strengthen the voice and make the voices count and be more for the voices to be heard. So today, as much as we are discussing Kibra, we will also be discussing different areas because these challenges is not only limited to Kibra. It is a regional issue, county issue, and even national issue. So indeed, menstrual poverty is something that has to come to the past in this 21st century period. So by the end of the day, as an environmentalist, I have an issue, Louisa, with the disposable pads, because when we do garbage collection, what we find the most is actually sanitary pads. So, and also, I'm not sure also about the reusable ones. I don't know the kind of quality, who came up with the quality of actually the pads that are supposed to be actually produced. So those are some of the issues that goes back to what Yasmin has said, the policy frameworks and the legal frameworks, and how to formulate the whole issue around the sanitary pads for the girls, for them to actually feel comfortable. Yes.
So thank you again. So I'd like to talk about menstrual product and the policies. In the Kenyan MHM policy, all products are covered there, including the reusables, and currently the ministry involved Kenya Bureau of Standards to check which are the specifications required for sanitary pads, different products, either reusables and disposable. Some products are registered under KEBS, while others are not registered. So we need to look at what we give out to the community. And my take is, don't give people what you can't use. Give them what you can use because they are human beings. So menstruation is a matter of human rights. Everybody should be treated equally. And young girls and women should be given the right products to manage their menses with dignities. Also, we need to have men and boys in these conversations because we are leaving young boys behind. It means this is a girl's issues. And wherever you're going to go to that school, talking about periods, young boys feel they are left behind. When we're giving girls dignity kits, let's also have a dignity pack for the boys. And we are giving education about MHM and reproductive health. Let's have like an inclusive educational forum where we can train holistically on puberty, where boys have to understand at puberty they start having wet dreams, as well as young girls start having their periods. And we need to train them that we are all the same, except our reproductive system that are different and they're divined at puberty. And back to manufacturers, we need to think about persons with disabilities because most of the products, they are not disability friendly. in school levels, communities, or like in public spaces, we don't have disability-friendly wash facilities. So if these facilities are not friendly, it means persons with disabilities are left behind, and then we can't have inclusion and equality when we are talking on achieving the SDGs. So we need to have a holistic approach and an inclusional environment where all challenges facing people with disabilities and the normal people, I'm not sure with the normal people, but also we need to have those who are people are able differently, able to use the menstrual product and can have wash facilities that are user-friendly. We also need to talk about having running water in schools, in communities, because during that time of the month, we need to keep our hygiene standards high. So these young people at the school level, communities, women and girls, need to have water for personal hygiene. For those who are using reusable menstrual products as well for washing and reusing. On sustainability and the environment, let's focus on products that are environmental friendly and cost effective. Let's have centers at the community level that can train women on how to make, let's say, reusable sanitary pads. Because if they're making these sanitary pads, it means they have a source of income, and we are going to end the challenges of teenage pregnancies, transactional sex. Because we find in most cases, young girls are taken advantage of by the Buddha guys, for example. We need to have these people trained so that they can understand. They need to support the young girls rather than taking advantage based on the situation they are in. And also, Mheshimiwa, when you're going to Parliament, let's have laws that can even live in prison people are taking advantage of young girls. Transactional sex for water. You know, how can someone sell her body just because of water? Water is life. And these men, when they're engaging in protected sex, it means they don't care about the well-being of the young people. So let's have everybody having the right information about menstrual health and all the support systems so that we can end period poverty.
I didn't see the ball coming down. Okay, well, I wanted to talk about inequalities, the already existing inequalities, because we cannot achieve period sustainability, or rather ending period poverty and shame, when you don't talk about the already existing inequalities. When women are not given the opportunity to lead, or rather to take an initiative, it could be in either social, economic, or political spaces, or rather engage into social, economic, and political activities, that it will be really hard for them to access these menstrual products. Then when you talk about inequalities, you find that 65% of women and girls don't have access to quality menstrual products, and even access to knowledge and information on matters to do with menstrual health. When you talk about accessing menstrual products, then you also need to talk about knowledge and information around menstrual health. Because again, maybe some of them who come from underserved communities like Kibra, they don't know if you overstay with their sanitary towels for a period of up to 6 hours, then you might end up getting toxic shock syndrome. They don't know such information. So it is upon us as menstrual champions to be in the front line in imparting knowledge and information around menstrual health management, and as well as work around the already existing inequalities in different spaces, political, social, and economic. And talking about social, economic, and or rather the development sphere, you find that a woman or a girl cannot socialize freely when she is not menstruating in dignity. A girl will not perform well in school when she doesn't have access to quality menstrual product, or even just go to school, simply because she doesn't have anything to absorb the menstruation. A woman who is working and she's having